Welcome to the Healthy Lifestyles Podcast, located here in Northwest Phoenix, Glendale, and Peoria. My name is Dr. Nick Hunter. I am a doctor of physical therapy, and I own and operate Preferred Physical Therapy, where we have helped hundreds of people aged 40 plus stay active, independent, live free from painkillers, and avoid surgery, even if they've had pain for years. I have written over 8 ebooks on how to treat common injuries and hosted numerous webinars, all in an effort to help educate the public on how to care for and maintain their bodies to live with joy, dignity, and without compromise. This podcast is intended to help you make better decisions about your health so you can find joy in the journey by bringing together top healthcare providers, fitness experts, and nutritionists in the area to give you the knowledge and confidence needed to make good health decisions. Thank you for joining us today. Today we have Lauri Leadley, clinical sleep educator and president of Valley Sleep Centers. She is the creator of Sleep Well Sunday, blogger and media go-to for all things sleep. Mrs. Leadley's fascination with the physiology of sleep began more than 30 years ago when she was a respiratory therapist treating a patient with sleep apnea for the first time. It's what ultimately inspired her to become a sleep technologist. One day, one of her patients who woke up after a sleep study said, "Wow, Lauri, I've never dreamt before. Last night I had dreams." Can you imagine? This stunning revelation was a pivotal moment, a turning point in her career. It is what propelled her forward in demystifying all aspects of sleep. Most would agree that as a society, our day is measured by how much we get done. It's often a race against time to do all the things. But the human body needs adequate sleep. The health of its physical, mental, and spiritual condition relies on it. Good sleep, sound sleep, the kind that refreshes and motivates one to tackle the day. Lauri is a 2-time cancer survivor. She was diagnosed at the early age of 26 while carrying her youngest. To say that chronic pain, discomfort, and let's just say it, cancer, disrupted her sleep is an understatement. Through treatment after treatment, carrying her pregnancy, plus being the CEO of her fledgling business, she knew she couldn't ignore the consequences of poor sleep any longer. However, she'll tell you that it wasn't until her second cancer diagnosis that struggling to fall asleep and stay asleep was negatively impacting her body's ability to heal. This perpetual state of unrest, chronic pain, and anxiety would have consequences. She knew that if she wanted to live to see the day when taking her grandkids to Disneyland was a thing, she'd have to take her own advice. Sometimes that's the hardest part. Lauri has been changing her patients' minds about sleep for over 2 decades. With 6 Valley Sleep Center locations and a 7th opening, a team of 150 people, including MDs, nurse practitioners, and other providers who are board certified in sleep like psychologists, respiratory therapists, and industry professionals to educate and inform, treat, and research sleep. She has helped tens of thousands of patients reclaim their sound slumber, and there's no telling where the next couple of decades will take her. Well, Lauri, it's a pleasure to have you on the show today. Thank you very much for joining us, and what a fantastic intro. Is there anything I missed in that intro?
No, thank you, Dr. Hunter, for having me on. I'm really happy to be here and can't wait to talk to you more about sleep.
Now, I know you already mentioned all the things that have really sparked your passion around studying sleep. Is there anything in particular that you have just felt maybe even sparked by or so excited about what it is in studying sleep and helping people sleep better that has continued your passion today?
You know, a lot of it is just the sheer changing lives, right? When you finally recognize, hey, I might have a sleep disorder, and then you just do it and finally come in, and then you find the appropriate treatment for your sleep disorder. It is truly life-changing, and that is why I'm so passionate about what I do. You mentioned in my intro that, you know, the first time I ran a sleep study and the patient said, "I've never had dreams and I dreamt for the first time." Like the joy in my journey at that time was just absolutely beautiful. But, you know, being a really young mom and having cancer and starting a company before I was even 30 years old, I was a very poor sleeper. I worked night shift, being a respiratory therapist. I never made sleep a priority, right? And it took a toll on my body, as you said. And over time, like learning about different sleep disorders and watching people have these sleep apnea diagnoses and events. I was actually watching people stopping breathing, and my dad was a terrible snorer. Like we would all be like, "Oh gosh, we can't stay in the same hotel. I'm sleeping in the bathtub. Like there's no way, right?"
Yeah. Wow. Yeah.
And then over the years, I started to snore, right? And it wasn't until I had a daughter-in-law one Thanksgiving who like locked herself in the bathtub in the hotel bathroom when we all stayed together one Thanksgiving night, and I was like, I have like I know this stuff. Like, and so I wasn't taking it seriously. I knew that I probably had sleep apnea. I'd had sleep studies. I tried CPAP. I can't do it. I can't do it. And I have the best people at my fingertips. Plus, this is my expertise. I'm a respiratory therapist. I'm a sleep technologist. Like I should know how to be able to wear CPAP. And it wasn't until my second cancer diagnosis that I truly took it seriously, and I found an alternate to wearing CPAP, which is upper airway stimulation. We call it Inspire. And my sleep apnea is finally treated, and I can't believe I waited this long. It didn't occur to me until, they keep checking me to see if my cancers are coming back, that I realize I have to have my health at the utmost like level, or
Hmm.
I'm going to be in pain. I also had two back surgeries because of all the chemotherapy I've had and the medications. I lost the discs juice
Disc
in
height.
my and
Yep.
yeah, the disc height. There you go. I call it juice, but
Yeah. Juice
I
is fine.
lost the disc height and I was in terrible pain. Um, but I also wasn't functionally taking care of my body the way that I should. Like I
Yeah.
wasn't really working out. I was doing yoga, but yoga can also, if you don't do it exactly right, it's worse on you can
It
hurt
can be
yourself.
bad for your back. Yes,
You can
absolutely.
hurt
Shoulders,
yourself.
back, and neck. We see that often.
And so, not only was I not doing what I was supposed to during the day, but I wasn't sleeping. I wasn't getting that optimal sleep at night. And so my body was failing. So I'm a big believer in taking care of myself now. And then I try to pay it forward and teach people what I've learned to do for myself, for, the public and our patients as well.
So you said something interesting to me, and just back up for a minute. You
Mhm.
said um, sleep apnea can be treated without CPAPs.
Yes. Yes.
That
Okay.
sounds groundbreaking to me.
Yeah.
Because everyone I
Yeah.
talk to
So,
who has been diagnosed with sleep apnea are confined to the CPAP, and it is
no.
loud, it's obnoxious, hard for the spouse or the partner to sleep in the same room.
Yeah.
There's all kinds of things that go on with having to do a CPAP. So tell
Well,
us about that.
well, there's a lot of myths out there, and this is one of them. CPAP is not loud. It's not big. It's actually very small now. Like we even have a travel size the size of your cell phone. It's
Awesome.
very quiet. If your mask fits properly, you shouldn't hear anything. It should be totally quiet. And and what you had before was a snoring bed partner, and now you should have a
Hmm.
quiet bed partner, and the machine itself is super silent. And again, if you have struggles around the CPAP like I did, there's oral appliances that you can have made by a dentist. A board certified sleep dentist is what I recommend, because there's a lot of dentists out there that will just say they can make an appliance. But I really like you to go to the ones that really truly have the hours in sleep medicine, because it, it's
Interesting.
it's a it, it's definitely an art,
Yeah.
and you want to make sure you get the right one. Those work great on people with mild to moderate sleep apnea, but my sleep apnea kind of crossed over to severe as I got older, and so I had to search for alternate treatments or go back to CPAP. And I unfortunately I was getting pneumonia a lot, and I had rheumatoid arthritis as a child, and so my immune system and my lungs aren't good. And if I get a cold, it usually goes to my lungs. And so wearing CPAP was really difficult. And then I kind of had it in my head that if I didn't have it super clean, that maybe that was causing some of my pneumonias.
Hmm.
And so I just, in 2019, very beginning of 2020, I just thought I've got to start taking this seriously, because I'd had a bad pneumonia in August of 2019. where I was hospitalized, and then they thought it was metastases from my cancer, but it wasn't. And I just thought I got to treat my sleep apnea. So I learned about Inspire, which is a surgical implantable device. It's kind of like the size of a pacemaker. It goes in the chest underneath, just kind of right where you have a pacemaker, only on the right side. For me, they ended up putting mine in my armpit area, like along the bra strap line, because of the fact that I've had all the surgery for my
Mm,
breast cancer. And so I have a remote control, and I basically push a button at night, and it stimulates like a lead, like almost similar to a TENS unit.
yeah.
And it's just this electrical stimulation. And as you fall asleep, it syncs up to your breath. So there's a lead wire that goes all the way down to the diaphragm, and it syncs up with the breath, and then it stimulates. It hooks to the hypoglossal nerve, and it kind of presses your tongue forward and gets your tongue out of the way, because that's what causes the obstructive sleep apnea and the
This is
snoring,
amazing.
is that tongue dropping back. So yeah,
Okay.
and we do all three of these treatments at Valley Sleep Center. So it's it's just kind of part of our comprehensive, sleep clinic. We don't just do sleep studies. We do
Right.
all of the treatments as well.
So that's amazing. I had no idea they had an implantable device that's going to help maximize the efficiency of how your mouth should be positioned for the air to come in. And then also you said it does trigger the contraction of the diaphragm to then
Hmm.
lower the diaphragm
Yeah,
and pull air in as it clears your
yeah,
tongue in your
yeah.
mouth.
It's more of just a stimulation of the back of the airway, right? It's just syncing up with your breath
Yeah.
through the diaphragm. But there's another
Amazing.
treatment for central sleep apnea, which central sleep apnea is different than obstructive sleep apnea. We see central sleep apnea in a lot of patients with congestive heart failure or heart
Yep.
arrhythmias. And so there's a new treatment called Remedy. It's the same neuro modular technology, right? But it actually signals the diaphragm to take a breath.
Oh, okay. Wow.
So
It jumpstarts it.
there's a whole bunch of this stuff. Have you heard about I don't know the name of it, but you might know there's a new electrical stimulator that's working for stroke victims for upper body movement. Do you know about that one?
We've seen the one with the foot where it'll help pull the toes up to help clear the toes from like a foot drop
Yeah,
situation.
but
Um,
there's a new one for upper body. I'll hook you
no.
up with him. I'll hook you up with him.
Wow.
Yeah. So really fascinating technologies are coming out because of this neuromod, which you've seen with pain. It's the same technology with the oh
Yeah,
gosh, what's
yeah,
the name
yeah.
of it? The
Spinal
device.
stimulators, yeah,
Yeah,
TENS
spinal
units or
stimulator. It's the
interferential
same.
currents,
It's the
all these that have been
same
going on for a long
medical.
time for pain modulation. And we've been
Yeah.
using some of those things, in the orthopedic world for um, to help with muscle contraction, particularly so it's fighting against atrophy. Atrophy is what happens after you rest a muscle for a prolonged period of time. It gets weakened and short and smaller. And so we'll
Hmm.
use electrical stimulation to maintain contraction in that muscle so that it doesn't shrink and we have less of a hole or a deficit to get out of in a rehabilitative world. And so now you're saying we're using these things on or these ones that are involuntary muscles, ones that are automatic
Hmm.
for us, and you're
Yeah.
able to then, as you say, neuromodulate, sync it up to how it's already functioning,
Yeah.
to then enhance it and optimize its functionality so that we can return to a more optimal state. This is incredible.
It's so
We
good,
have a lot
huh?
of work to do because I mean, I hear every patient we talk to about sleep pattern, who have sleep apnea, all I hear about are the difficulties with the CPAP. Like I've
Well,
never
you
heard
need to send
of
them to us.
of the better ones,
We'll
the
fix them.
small, quiet ones. Like this is amazing.
Yeah.
So it's always been the big, loud units. The spouse is always complaining about it too. This is really interesting to hear about.
Well, and it's so important, right, that you are treating, that sleep apnea, and I know that you see these patients struggling with pain and things in your clinic. And so it is really important that you do encourage them to treat their sleep apnea, because if they don't treat their sleep apnea, then their brain is not getting that optimal rest. And so the body can't heal itself like it needs
100%. And
to.
that's like for our fall prevention. A lot of our folks who have issues with CPAP machines are in our fall prevention, or we see a lot of arthritic hips, knees, and backs. All of it requires mobility. And so when they're not
Hmm.
well rested and they're getting up from sleep, not well rested, and then it's always going to the bathroom, we are at
Hmm.
increased risk of fall. And
Yeah.
so just knowing that there's some additional avenues for appropriate care that include better sleep, better sleep apnea devices, better CPAPs, and other alternatives that exist to help people to get that restful sleep
Here's
is
another one.
phenomenal.
Just say you have mild sleep apnea, like positional, like you only have it on your back. So we even have a product called Night Balance. It's made by Philips, and it's a belt that you wear that can detect when you roll onto your back, and then it kind of buzzes so you roll back on your side. Because a lot of
Interesting.
sleep apnea is positional. So yeah, there's a lot of alternative treatments these
So
days.
walk
So
us through how a sleep study works, because this is fascinating to
yeah,
me, and I think a lot of people
it
just
is.
have no idea,
Okay.
or they're overwhelmed with the thought of sleeping in a place. Like we've seen some of the ones
Yeah.
on TV where it's like it does not look like a place conducive to sleep. I'll just say that.
Well,
Tell us
I
about
I kind of like to have a side hustle where I like to decorate. So I think I just started
it.
opening these places so I could decorate. I'm teasing. No, so basically, Valley Sleep Center is a full, comprehensive diagnostic and treatment center for sleep, all sleep disorders. But so you would even self-refer. You don't have to have a referral. You can just call up, go online, and you can
You can say,
book a
I'm
sleep.
wondering if I have this. I don't sleep very well, or my spouse is complaining about my snoring. Maybe
Yeah,
this is something I get checked out. And I can just walk
and
in
if
or
you're,
call
yeah,
and say, hey, I'd like to get an appointment.
right. So if I'm tired all the time or I feel fatigued, you definitely want to come in and have a sleep consultation. So that would just be like your normal doctor's office visit, right? Where
Yeah.
our sleep specialist would go through questionnaire. We do some measurements of your neck, because if you have a neck that's 15, 17 inches in diameter, you probably are a higher risk. Well, you are a higher risk. You probably have sleep apnea. So
Mine's 15 and a half.
athlete,
My collar is
ath-
15.
yeah, athletes, we
Okay.
see that athletes have large necks. A lot of athletes have untreated obstructive sleep apnea. So, if you're seeing athletes, you definitely want to encourage them. So, basically, once you have your sleep consultation, we'll order a sleep study. So, it'll either be at home or in the sleep center. So, insurance nowadays, this is all covered by health insurance, does dictate whether or not you get a home sleep test or an in the lab. So, home sleep tests are really cool. You either take it home with you or we mail it to you. You wear it. It's like an oximeter on your finger, a couple of belts, and then maybe an airflow device in your nose to measure your snoring. You'll have an EKG patch to measure your heart rhythm, and then the belts detect effort, right? And then the oximeter is for oxygen level. So if your oxygen level drops, 3 to 4% all night long, then you probably have respiratory disturbance, which is also a clinical indication that you probably have obstructive sleep apnea. So you would do that at home overnight and then mail it back. There's also, um, it's like a watch that you wear on your arm, and that can be. And then we have this new thing that I haven't launched yet, but it's called the ring. And you just put the ring on your thumb and sleep with it like that, and it can tell if you have sleep apnea. Super cool.
That's
Lots
it.
of
It
lots
could
of
be a
cool things.
ring or
That's it.
a
Yep.
wearable wristwatch of some sort.
Right. And then
Wow.
if
Okay.
so, and then if we feel like you would be a better candidate, so that's for high probability of obstructive sleep apnea. That's what home sleep testing is for, because home sleep testing isn't a sleep study. It's a test for highly probable people that probably have
There is a
obstructive sleep
difference.
apnea. There's a
Okay.
difference. So for a sleep study, which the technical name is polysomnograph or polysomnography, which is EEG,
Mm,
eye movement, muscle tone, airflow, air effort, oximetry, muscle tone, arms and legs. So we're looking at like 30 different parameters.
wow.
But what that would look like is you would come in to whichever center we've assigned you to. You'll have a technologist that's registered in sleep. They have two patients a night, and you'll get your own private room with your own private bathroom. Most of our rooms have showers in them, or a shower is available for you. So if you have to go to work the next day, you'll have that. But basically, you'll meet your technologist, you'll do some paperwork, and then they'll spend about 40 minutes hooking you up. You'll have wireless internet. There's a TV. Of course, we don't encourage watching TV before bed, but some people just have to. So we want you to feel like you're in the comfort of your own home or a really nice resort. Some people don't want to leave. They're like, can I stay another night? And
Just
then
get one more test
basically,
in. Yeah.
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 So once we get you all hooked up, we go into our tech room where we're going to sit all night awake. We watch you all night, and you're on a little camera, which is like tiny little, it's just to see position. It's not like we can even see your eyelashes or your nostrils or anything. It's more for position. What we're looking at is all of your physiological parameters, your EEG, your airflow, your oximetry, your EKG, your muscle tone. And we're staging what sleep you're in. We're scoring respiratory disturbances. We're identifying any cardiac arrhythmias. And so we do that all night long as your sleep study is recorded. And then we're documenting every 30 minutes on paper what we see and hear and things like that, right? How many apneas, loud snoring, mild snoring, things like that. So that the doctor, when they come in the next morning, now you're going to go home. You're not going to see the doctor the next morning. You're going to wake up, you're going to get all unhooked, and you're either going to take a hot shower and go to work, or you're just going to go home as you get discharged. And then you'll have a follow-up appointment with our provider already scheduled. And then when you come in for that provider appointment, we'll go over the sleep study results. What we see mostly is obstructive sleep apnea. So we're going to say, hey, we're going to start you out on, CPAP. This is where we think. Let me back up a little bit. So
Yeah.
as we're running the sleep study, if we see that you do have a lot of obstructive sleep apnea, we're going to come in halfway through that night and put CPAP on you and try it. You're going to wear
Okay.
it, and we're going to try to get you to the pressure on the CPAP that fixes your sleep apnea. And that's where my patient, I did that, and he said, I had Tourette. So as soon as, he was so severe, like people will have these apneas where they stop breathing for a minute.
Jeez
And it is
Louise.
literally like you're running a marathon all night long. You're not sleeping.
No wonder why you're
Your
exhausted.
your nervous system is, in that fight flight mode. You are like fighting for your life because you stop breathing, and then your oxygen level drops, and then your heart goes like, what the heck do I do? And then, your body eventually somehow makes a movement where the airway opens, and then it happens again and again and
Yeah.
again. So
So you
so
have
basically,
attendants there at the facility the entire time. You have
yep, yep.
guests
No,
or
we
patients there,
yeah.
and
And if you have to get up to go to the
they're
bathroom,
watching
you
the whole
can.
time. We have people who are watching the whole night.
Yes, yeah, they don't sleep. They have to
Okay.
stay awake
Okay.
all night and
I
watch.
just want to
Yeah.
make sure I get a good picture of it. Okay.
Yeah, yeah. And so if you wake up and you have to go to the bathroom, we see you wake up, right? And so we come in and we unhook you, not the whole thing, but we just take the box,
Yeah.
that all the wires are plugged into, the amplifier. We unplug that, and then you go to the bathroom. And then you come back, we plug it back in, you go back to sleep. So half the night is a diagnostic test, and half the night is that therapy where we're putting on the
Is
CPAP.
some treatment. Yeah.
Right.
Okay.
So some people don't have severe sleep apnea or moderate. They don't qualify for that CPAP treatment in that first half of the night. It might take them the whole night of sleeping and have the whole study, and they might have to come back a second night. But now we have AutoPAP, which is CPAP that's automated, that actually we can prescribe and you can have at home, and it'll automatically increase to the pressure that you need. So really these days, we just need a actual diagnosis of sleep apnea because we have just the technology is so great that we can treat it automatically with that CPAP.
Yeah. Wow. That's awesome. What an incredible story. So there's a whole lot of data. I mean, that is a long 8+ hour ordeal of capturing data and then treating some of whatever might have been found to then get a
Mm-hmm.
result. I mean, that sounds obviously quite thorough compared to what we typically see when we have other conditions. You go see a doctor and it's what, 10 to 15 minutes of time. This is
Yeah,
8 hours of data
it's
collection.
it's one of the most comprehensive sleep, or it's it's one of the most comprehensive tests or studies out there because we look at so many different things, right?
Yeah. Wow.
Yeah, it's a good one. And then, if you don't have sleep apnea, but you're tired all the time, maybe you have narcolepsy or idiohypersomnia. So we might have you stay over the next day and we do little naps. So you stay over the room, you have the room all day, and then we wake you up. When you wake up on your own, you have 2 hours of wake time. And then we make the room dark for 20 minutes and we see what if you actually go into REM sleep. And we do that for 5 naps. And so if you go into REM sleep 3 out of 5 of those naps, then you're probably going to get a diagnosis of narcolepsy, which is treated with medication. So
Wow.
kind of a rare sleep disorder, but very important that, and you'll see this in early teens, like maybe college.
Mm,
We all have these teenagers that won't get out of bed because they have a circadian rhythm shift when they become adolescents. But it is really important if they are really, really tired all the time and sleeping all the time that they come in to see us and get
wow.
assessed. Yeah.
That's really good to know. So sleep apnea, narcolepsy, are there other sleep disorders the public should be aware
Oh
of?
yeah. Yeah. There's periodic limb movement disorder, which is like you're
Periodic
kicking,
limb movement
moving.
disorder. Okay.
Yeah. Yeah. You're moving it's excessive, muscle twitches and you're moving a lot. So those are treated with medication. There's insomnia, which we don't need a sleep study to diagnose insomnia. There's treatments that we do, cognitive behavioral therapy for insomnia. Um, just
Interesting.
teaching people mindfulness. Insomnia is literally just the definition of the inability to fall asleep, or excuse me, insomnia is the inability to fall asleep and stay asleep, but it's also just the inability to escape one's thoughts. So what we try to teach people is how to escape their thoughts. So
Interesting. That's
yeah,
fascinating.
um, it is. So yeah, some other sleep disorders. REM behavior disorder is a big one. We see this a lot in men over 65. Very common with Parkinson's. It's
Mm,
where people will act out their dreams, but they're not truly in a healthy state of REM. A healthy state of REM, rapid eye movement sleep, you shouldn't have any muscle tone except for your uh, diaphragm and your eyelids. But people who have REM behavior disorder, their muscles work. So they start acting out their dreams, becoming a danger to themselves and others. So,
wow. That sounds fascinating. So I'm just trying to think of that. We've seen a lot of patients come through our doors with difficulties in healing, tried a lot of different things to take care of joint related pain or age related arthritis, degeneration of low back. And I'm starting to think there's a lot of this that we can affect from our standpoint with physical therapy, but also oftentimes in weight reduction or weight management. And I think that this other aspect is sleep and rest, where they're just not getting good enough rest. And we kind of talked about sleep's impact on blood flow, right? I see a large amount of my patients with some kind of blood flow disorder. And I say disorder in terms of because our bodies work and the way our blood pumps is from our heart out, but then our muscles and extremities move to then bring the blood back to our heart. So there's a cycle. And
mm-hmm,
without adequate activity or difficulty with activity because of pain or immobility or fall, fear of falling, there's a reduction in that. Now, what is it that sleep can do to help improve blood flow?
well, it's all about wellness, right? So,
Yeah,
part of wellness is making sure that you have um, good sleep, that you're eating the right foods, and that you're being active with your body at least 30 minutes a day. So, without those three things, it's going to be more difficult for your body to heal. And so, the sleep piece is this. So, imagine that your body is your cell phone, and at night you're going to plug in your cell phone all night long so that the battery gets charged, right? So that's why it's so important to make sure that you go to sleep at night so that you're plugging in your brain, which restores all of your bodily functions, your metabolism, cardiovascular system. It lowers your blood pressure. restoring all the muscle tissues, allowing the body to heal itself. And if you don't sleep all night, or you have interrupted sleep through snoring, respiratory disturbance, pets, environmental things, then your body isn't going to get that restorative sleep, and the battery isn't going to charge. And it's like,
Hmm.
have you ever plugged your phone in and then you thought it was plugged in, and then you go to look at it and you're like, oh, that's not going to get me through till noon.
Right.
Well, that's what happens with your body. Your body's like, fatigued. I can't do it. And then what do you want to do? You want to drink sugar, caffeinated beverages, eat carbs that are bad, white carbs for energy. And then you become in this cycle where you gain weight, right? And then when your body doesn't restore, it isn't allowed, that metabolism can't restore, it can't fight and keep your weight healthy. And then you certainly don't want to move your body for 30 minutes if you're tired,
Absolutely. So
right?
yeah, that's fantastic. You're putting it full circle, and it's zooming out and seeing from an overall aerial view of what a well-balanced wellness routine looks like. It includes diet, exercise, and sleep. I think diet and
Mm-hmm.
exercise get a lot of publicity, and we hope that it
Sleep.
impacts sleep,
Mm-hmm.
but we don't often pay attention to sleep and the impacts of what poor sleep would look like, particularly in our efforts to manage the first two of exercise and diet. So that's phenomenal. As far as like a course of treatment under your care, what does that look like? I know you kind of mentioned some of the more advanced techniques for implantable devices and technology and CPAP use. Are there any other treatments that you guys do?
Yeah. So, back to the sleep apnea patient. So, we also provide the CPAP for most insurances. There's some we have to send out, but you're still going to follow up with us, and we're going to check for compliance, because now insurance doesn't pay outright for the treatment of sleep apnea. You have to prove that you're using it, right?
Hmm.
So you'll have to come in for follow-up visits. And so,
Interesting.
I tell people you have to make the commitment, right? And I know you have to do this with your patients as well. Like, this is a journey. We're going to help you through it. And so if someone is struggling with CPAP, it's not fitting right, or it's loud, or they feel claustrophobic, then when you come to see us and follow up, we'll help direct you to, one of our CBTI providers, a PhD who's board certified in sleep, that does behavioral therapy, which is cognitive behavioral therapy. We have a couple nurse practitioners that also specialize in helping people work through that insomnia that they might be getting, where they can't fall
Yeah.
asleep and stay asleep. We have respiratory therapists and sleep technologists that work during the day, that will meet with you and help you work through those difficult, things with the CPAP. We just don't want you giving up on the first or second night and then having your CPAP machine end up as a doorstop, or just in the closet, or you're selling it on marketplace. Like, we really truly want to help you be successful, because it's going to give you more days in your life, and you're going to feel better. And we want
Yeah.
to change your life through this, because you came to us because you felt miserable, and we
Right.
want to change that. So it's a
I
whole
love that.
program, and we want to help you be successful. And if you fail on the CPAP, then we send you to an oral appliance or a surgeon to get Inspire. So there's options, right?
So you partner with them through a relentless pursuit to find the
Yeah,
issue, the root cause, and help deliver success. But I
yeah.
love that, and that's exactly what the kind of people that we like to partner with, because it's right in line with what we're trying to do. We get a lot of patients who have tried PT in the past. They go to regular in-network PT, and then they find us because we're mostly out of network. We only take one insurance right now. Everything else is direct pay or out of network.
Hmm.
And it's because we're able to spend a full 60 minutes of undivided attention with the patient, which very different from what they've experienced in the past. And so unlike regular physical therapy where they're getting herded in and seen with 3 to 4 other patients at one time by one PT and getting 10 to 15 minutes of care, it's a very different experience where in our situation, our model of care, it's about undivided attention around identifying the root cause and then delivering a treatment plan that's ultimately going to deliver success. And that's
Hmm.
what we want to be able to do. Exactly what you're talking about, in a similar or shared passion of relentlessly going after what is it going to take to help this patient get better and get the sleep, the rest that they need so they can have more life in their day.
We even have a program that we've been able to develop that is billable through insurance. It's called Sleep to Slender because so many of our patients, by the time we do see them, obesity is a factor. And so we
Yeah.
want to help them lose that weight. And so our nurse practitioners can meet with them and help them with, a plan of, a food, a diet plan. I have a private Facebook group that they can join, and we work out 3 times a week in
Oh,
that group. Like
fantastic.
on Mondays, we do like a HIIT class, and we show
Yeah.
modifications for everyone. On Wednesday, we do the bike. We do like a spin class, and then I also teach yoga on Wednesdays, and then on Fridays we do a weight training. And so again, we will teach the modifications for everybody because um, I've never struggled with obesity, but I have struggled with pain and being able to, not being able to do certain things. I've had to modify. And there were days I'd go to a yoga room and just stand there because I wasn't allowed to bend, lift, or twist. And so I would just balance on one leg, and
Hmm.
just do the things that I could do. And after having surgery and all the chemo, I had these little like pink 2 pound weights that I could only do. And I remember even going to physical therapy and, using the cable, like, and I could barely like pull down the cable,
Yeah.
and hold in, and engage my whole abdominal and pelvic floor. Like it
Yeah.
was
Your deep
really,
core.
really difficult to do that. And just
Yeah.
over time, when you practice it, you just get stronger and stronger and stronger. So it's taken me 7 years to get to where I'm at. And I'm, 56 years old and I'm stronger than I ever have been in my whole life
That's
because I've
fantastic.
done the work. You got to do the work.
That is absolutely what we want to preach to everyone because it is one of those where, especially in physical therapy, there's no simple, easy treatment. I mean, to a degree that there is, the simple treatment is the fact that you have to do the exercise, but it is a
Mhm.
matter of consistent pursuit to get those things done to demand the change that the body has to make to get better. And I love that you mentioned the fact that there's modifications and you're so quick to mention the fact that modifications, everyone's going to start from a different place and everyone has the chance to find out where is their starting point and we'll help you
Mhm.
identify that where that is and where you can have success at that point to then move forward and ultimately, hopefully, like you, be in the best shape of their lives.
And be
And
proud of yourself, right? Like do something small and then praise yourself, love yourself for it because it is hard. And don't you can't have the I can't or I won't attitude. You're going to have I can, and then you do, and then you need to tell yourself that you're really proud of yourself. That's what's important. Like you don't have to look like this person over here when they do it. Just be proud of
right.
yourself for putting in the work, right?
Yeah. I tell my boys all the time,
We
I can't yet. We will. Maybe not right now, but I can't yet. We'll find a way.
right. Keep your eyes on the prize,
Yeah. Well, that's
right?
fantastic. Is there anything that you tell your patients or clients every day that you wish you could record and just and put on repeat?
Just do it. Don't give up. Just do it.
Love it.
Right?
A
Yeah.
lot of encouragement.
Uh, and you don't know what you don't know. So you don't know what it's like to have good sleep until you have it. So many people, they don't even know what a good night's sleep is because their whole life they've had a sleep disorder.
I totally agree with you. I've had patients who have had back pain for years and they don't even remember what life was like without a backache. Like
Yeah.
they just all they remember is what it's like to have one. And the minute you give them a little bit of relief, it's like suddenly a spark goes off and they remember, oh, this is what it should be like. And
You know,
why should we go through and accept that as our new normal? It shouldn't be the case. And just because you don't know about sleep, if you have sleep apnea or have difficulties with sleep, it's one of those where at this stage in our life, it's go find out, go check, have it investigated. Because what if it does make that difference in your life that then allows you to either be more active, pursue a healthier lifestyle, and make Disneyland a thing. Make it so you can return those things you've always wanted to do.
yeah. It's so true. And I didn't realize how bad my pain was until it was better. Right.
Right.
So that was, I mean, I kept saying, I'm 50% better. Okay. I'm 80% better. Oh my gosh, I'm 85% better. And then one day I just was like, I don't have pain anymore. It just
Phenomenal.
happened, but it only happened through me doing the work, you know. That
Absolutely.
that's what took my pain away is me building my body's muscles and tissues strong enough to hold the skeletal structure. That's what it took.
Fantastic. Well, you've been an absolute joy to have on our show. Thank you for your time. What's the best way to
Yeah.
get in touch with you? Where can our listeners find you?
Yeah. So I have a website, lauriledley.com. Or on Facebook, you can look me up, Lauri Ledley, Valley Sleep Center. I'm also on Instagram at Lauri Lynn. So LauriLynn. And
LYN.
I would love it if you guys would subscribe to my YouTube channel, which is Valley Sleep Center, all one word, lowercase. And you can even participate in some of my yoga from there.
Oh,
So,
fantastic. Awesome. We'll have a
yeah.
lot of those links in our show notes after editing. So that'll be great.
Yeah. Thank you. Thank you.
All right. Thank you very much. I appreciate having you on the show.